Hello, I'm Ryan Ferdyhurt with the Center for Practical Bioethics, and this is the Clinical Ethics Corner. Who we are is a deeply fundamental question to human life, but one that is actually extremely difficult to answer. A major topic in philosophy is the questions of what does it mean for a person to be a person? Who are we? Are we our bodies? Are we our history and experiences? Or are we our own genetic codes? It seems that we are all these things, but also each one does not tell the whole story of identity by itself. Our DNA, our genetics, is often seen as the true measure of who a person is. But is that enough? And also, if that is a person, does that person own their own genetic material? Can a person own their own genetic material? And following that, can someone own someone else's genetics? These are all very difficult questions that do not have an easy answer, but were brought up in a recent clinical ethics consult request. The patient had recently had a difficult pregnancy. The fetus was diagnosed with a genetic condition that was non-compatible with life. Mom was admitted to the hospital due to complications, but wanted to have her pregnancy end naturally. Labor soon began, and the fetus was delivered at 14 weeks gestation. Mom and dad understood, but they were incredibly saddened by everything. But they would also become even more distressed later. They soon informed the hospital that they had found out that, quote, not all of their baby was at the funeral home. This made the family extremely distraught, and they wanted to know more, and more importantly, why. They felt that they had gone through a terrible situation, and now they cannot even be at peace because they cannot even bury all of their baby. Of course, the hospital looked into the situation and found out that per pathology, they keep samples of tissues for 10 years in case more testing needs to be done. They do a histology of all under 20-week fetal losses. And mom said that they did not get her consent to take part of her baby, and she wanted them back as soon as possible. There currently is no consent for pathology that they are aware of. This touches into a larger policy that states if any tissue, part, limb, or organ is removed during an operation or procedure, the medical facility will handle it in accordance to that medical facility's policies. Similarly, I consulted on a scenario where a patient's surgical remains were being sold to a biobank without their consent. The hospital was selling genetic remains and genetic codes to those who might be able to profit off them without patient consent. If you were an ethicist in this case, what would you do? Does the family have cause to feel that their baby is not being buried complete? Do patients have the right to own their own genetic material? If a patient does not own their own genetic material, then who does? And if others are profiting off someone's DNA, does that person have a right to those profits? And finally, as technology marches forward, where do we go from here? These are challenging questions that healthcare professionals do not often come across, but is another situation that could benefit from involvement from clinical ethics. I'm Ryan Ferdyhurt with the Center for Practical Bioethics, and thank you for stopping by the Clinical Ethics Corner.